be. Right now, though, we'll turn to our Ask the Doctor segment. You know, we all know that despite doing everything possible to have a healthy pregnancy, expectant mothers can run into unexpected challenges. Dr. Antonio Gonzalez joins us now this morning to talk about ways to navigate some of those challenges. Dr. Gonzalez, good morning.
Good morning.
It's good to see you. So what is the most common problem that women do run into?
Well, with high-risk pregnancies, usually it is very common complications, high blood pressure, for example, in this community. And the second one I see quite commonly is diabetes. Those are the big complications that can place a pregnancy at risk for bad outcomes.
Aside from diabetes, what does constitute a high-risk pregnancy? I know I was 35 when the first time I got pregnant, and that was considered, you know, they had to monitor me because I was 35 already, but it's more than just age, right?
Correct. More than just age. Usually there are pre-existing conditions. More women with chronic disease, say hypertension, diabetes, lupus, will become pregnant. And those are the ones that tend to have the highest risk for unfortunate outcomes. So.
Now, are you, I understand, and correct me if I'm wrong, but you are a maternal fetal medicine specialist, is that right?
That is correct.
And what does that mean exactly?
Well, you have basic training in obstetrics and gynecology, and then you do additional training to help manage the complications that come about in pregnancy. Think of it as an internal medicine doctor, also, which is also an obstetrician and gynecologist. So you deal with a lot of other complications, surgical complications, medical complications that may arise in pregnancy and that were present before pregnancy.
Now, do you work with women who are already pregnant and are at high risk, or do you work to prevent high-risk pregnancies?
Well, high-risk pregnancies and complications in pregnancy, some of them can be prevented and some of them cannot. Some of them arise unexpectedly, but usually I work with both. Complications in pregnancy that arise during the pregnancy, for example, preeclampsia, those we can't prevent and we cannot foresee or forecast. Other conditions like lupus, hypertension, diabetes, etc., we know that they're present before the pregnancy, and those are the women that need to seek advice and counseling before the pregnancy with a high-risk obstetrician, MFM, maternal fetal medicine obstetrician, to establish a plan of care that will help minimize the risks that they may face during the pregnancy.
I would imagine.
So that would be ideal.
I would imagine too, though, sadly, there probably are times that you or their other physician has to say, you know, this is just not a good thing. Does that happen to get pregnant?
Correct. Most of the time, we can establish a plan of care and give guidance to the patient to optimize their health so that there's a low probability for bad outcomes. But some of them we have to tell them, I'm sorry, you know, it's not a good idea to become pregnant.
But that is not the ideal thing, and I know that's not what you work for, and that's why you probably do what you do, right?
Correct. We try to optimize the outcome of the pregnancy because we want a healthy mother and a healthy baby. I think, you know, every child has a right to be well born, if I could say it that way. And the best way to do that is to optimize the health of the mother before pregnancy and during the pregnancy.
All right, Dr. Antonio Gonzalez, thank you for what you do, and thank you for joining us this morning.
You're most welcome. Have a great day.
Okay, you as well. All right, we will take another break here.